Hi everyone, I'm Dr. Z. I'm a clinical psychologist specializing in transgender care. Welcome to my channel and welcome to Monday Q&A segment that is, as many of you know, starting to phase out. In fact, my YouTube presence is going to start to phase out. I know that a lot of you have expressed feeling upset that I'm phasing out from YouTube, but to be honest with you, my goal with I don't know why I'm fondling with this earring. It's driving me insane today, guys. My goal with YouTube has been to create a virtual library of content from somebody as specialized as I am in gender dysphoria, where each video is a standalone evergreen content that is educational and informative and helps you understand what you're struggling with and gives you tips and guidance. And at this point, honestly, I feel like I pretty much covered everything and anything under the sun in relationship to gender dysphoria. If you've been following this channel for many years that it has been on, you are well aware about that. I have covered anything and everything one really needs to know about gender dysphoria. There's over 200 videos on this channel. And so I got to the point where moving forward would be a repetition of a content, and I'm a very creative individual, so I would like to move my energy towards something else. And I would very much appreciate if everybody would honor the decision and respect the decision, because I truly feel like what I decided to create on this platform has been accomplished and is such an amazing, in-depth, rich, evergreen content that anybody can go to it, regardless whether it has been 3 or 4 years since I released the video, and really learn a lot of information from it. So having said that, I still have some Q&As, questions from some of you in Q&A folders. At this point, I am not taking any more questions for the Q&A segment. But I do have some still in the folder, and I will do these videos until those phase out and I don't have any questions to go off on. For today, I have selected 6, as always, random questions on first-come basis. I'm very excited to see what we have here today for the on the table. I also want to say this is December season. It's a holiday season, and I do know that for a lot of you, holidays are very stressful time. Some of you don't have very good positive family ties. Some of you struggle in your relationships to your family, to your loved ones. So if you find yourself in a struggling phase in your life right now in regards to the holiday, practice self-care, take care of yourself. Holidays can be incredibly stressful, whether you do have supportive family or not. Having said that, let's dive in and see what we have. As always, I have blacked out individuals' names for privacy reasons, and there will be timestamps for the questions. So let's get rolling. Question number 1. Hello, Dr. Natalia. First of all, thanks a lot for your information, your book, blogs, and all of the support you offer to us suffering from gender dysphoria. You are so welcome. And if those of you who are first to my channel, there is a ton of blog information on my website, drzphd.com, as well as I started podcast just recently. And also I am creating and making online class content, gender-specific courses, each one aimed as a master class to help you combat certain obstacles. So if you want all of that, that link below in information. In your book, you talk about how important it is to stop coping with dysphoria, that you could start with something as simple, or I think you meant to start coping with gender dysphoria, that you could start with something as simple as accepting it, understanding there's nothing wrong or be ashamed of, coming out to your partner, or sharing it with someone to start the healing process. But my question is, what if that's all you can do about it and you feel that just not enough? If you feel you need to go through medical transition to reach that peace of mind and happiness with yourself, but it's not possible. Maybe because you have health issues that make it dangerous for you to go through hormone therapy, or you don't have access to it, or simply can't afford it. What can you do then? How can you accept or come to terms with your reality? Or what are the safer or healthier coping mechanisms, if any? Because I guess you could find other ways to express your true self, but you will always know deep inside that what you can do is just not enough. And you will still have to cope with your dysphoria in one way or another. Thank you for being there for us. This is a really, really important question because there are a lot of you out there who struggle with just really accepting your circumstances. Not only, we're not talking here necessarily accepting that you are transgender, accepting that you're struggling with gender dysphoria, but actually taking it a notch further and accepting any limiting circumstances you may have in your life. Limitations such as health concerns that prevent you from moving forward in the direction you want to move in with your gender. Limitations such as maybe your environment that you live in is incredibly unsafe and you can't even express yourself because your life will be in jeopardy. Other limitations are financial, for example. And this is a really tough one because acceptance in general is something very difficult for so many of us to cultivate. You know, the sad truth is all of us have one way or another limitations in life. Some are to a larger degree and some are to a lesser degree. We're all limited one way or another, whether we're limited by the scope of our abilities, whether we're limited by the scope of our resources, or we're limited by the scope of our surroundings. I think limitation is something all of us tend to struggle with one way or another. And of course, when it comes to limitations in regards to something as so significant as your authentic self, it can be even more challenging, absolutely, because it's hard when it's tied to such a significant part of who you are. I still am going to go back and say that acceptance is still going to play a vital key because no matter how difficult or painful, one has to accept their circumstances. And if your circumstances are that your health prevents you from engaging in gender-affirming therapy, medical transition, then that is still something that you're going to have to accept. That is something you're going to have to find a way to make peace with. And that's a tough one. And that's the ability of you to be able to do that is going to depend on numerous things, including your personality, your typology, your mindset, and other things in your life as well. If you're in this position where you want to move forward with gender transition and you absolutely can't because the limitations are in place, things that you can do. One of the best, most powerful things that I found helpful for people to do is to go on a spiritual internal quest toward their authentic selves. Now, I know spiritual internal quest sounds very abstract. Essentially, what it is getting in touch with yourself, with your authentic self on a more internal plane. There's still a lot that one can do. You may not express outwardly your gender in terms of presentation, but you may express your authentic self in terms of relational aspects, in terms of how you relate, in terms of how you even engage in intimacy with people, whether it is sexual intimacy or whether it is intimacy of any kind. Remember, intimacy doesn't just have to be sexual. So there's definitely still things that one can do, right? Your gender identity should not just be boxed in only to physical body modification, although that is a tremendous big part of it for a lot of you who struggle with body dysphoria, specifically body gender dysphoria. So you don't really want to box yourself in one box. You want to realize that there's more to gender. If you gender identity more toward trans feminine or trans masculine, well, what does it mean for you? What qualities do you want to contemplate? What qualities do you want to elevate and bring into your life beyond just your expression, right? Because all of those things are not just external things, they're also internal. So I would encourage you to think about that. What qualities do you really want to bring into your life? Maybe make a list of them and see how you can start incorporating them in your life. But acceptance of your limitation is going to be a big and important piece of it. It is important to accept because if things cannot change, things cannot change. And dwelling on things that cannot change, for example, dwelling on the fact that your house prevents you from moving forward is only going to push you further into agony. So that's what I would recommend. Anybody else, share down below what are some of the things that you found to be helpful if you're struggling with limitations, to give these individuals some guidance. This is all day today is going to drive me nuts, people. Okay, question number 2. Dear Dr. Z, thank you again for all you do for the queer community. You are so welcome. I would like to share about certain activities and how gender dysphoria ties to them. I am an assigned male at birth undergraduate college student, and I am figuring my gender out. To clarify, nearly all of my life is internal spiritual. There we go. That's what I was talking about. All of my dysphoria is internal spiritual rather than external. Often socializing with other people minimizes and sometimes even takes my dysphoria away, especially if I'm with other queer people. That would make sense because when you're around people who are like-minded, who are more expressive, who are more, I would say, more gender fluid, there's less gender restrictions, people tend to feel more comfortable. I noticed that while I was at San Francisco Pride, I was able to talk how I wanted to talk, walk how I wanted to walk, and that made me feel comfortable in my body. Again, when we're around the environment or situations where we don't feel like there are restraints being placed on us, we become much more freer individuals. At that moment, I realized that feeling pressured to walk like a man and talk like a man by society and by my father have really been a driving force of my dysphoria. Can someone have gender expression dysphoria? Gender expression dysphoria, oftentimes I actually refer to as social dysphoria, rather than gender identity dysphoria. I think what you mean rather than physical gender dysphoria, let's call it that way, because it's all tied to one way or another towards identity. Other activities that have allowed me to feel comfortable in my body are doing yoga, that's wonderful, which I thought would worsen dysphoria, but I was wrong. Singing in choirs with my bass voice, due to the sense of community and the sense that my voice, as it is, can be part of something beautiful and greater than myself, and having sex, as I realized that I'm capable of giving and receiving love, pleasure, care, and intimacy through my body as it is. That is beautiful. I learned that during sex, my body can be a vessel of my soul. What could this all mean? I love how you said vessel of my soul. That's a beautiful way to look at this container without looking at it through a gendered lens, which we're all conditioned to look through socially. So this is what I'm picking up on. When you are in an environment and when you are around people who are gender open and expansive, you feel like you have a permission. You feel like you're able to be as expressive as you want, and there's nobody to judge you. There's no judgment, and there's no pressure to conform. When you are in an environment, when you are around your father, or like you say, society, you feel like there's a pressure to be like a man, right? To conform to the particular gender binary. What could this all mean? This could all mean that you're noticing the discrepancy. I would caution you to immediately jump to that means I'm transgender, right? Because you basically noticing this discrepancy in terms of how you feel in certain environments and how some other environments are restricting your sense of self. Sit with it. When you are in environments that are supportive and expansive and you allow yourself to be expressed, what is your own expression is telling you about yourself? I would also encourage you and everybody else to challenge themselves when they say things such as society and parents or anybody else are pressuring me to conform. when we think like that, we then feel as if there is truly that pressure. The reality is that I wouldn't really say that we're pressured to conform. I think a lot of us are conditioned subconsciously without even realizing it by just messages out there, messages on multitude of those things, advertising, shopping aisles, clothing department stores, you name it. We're pressured to look at gender through a very binary lens. I wouldn't say again word pressure, but conditioned, that's a better word. So I would challenge yourself that it may feel like you're being pressured, but you still have liberty of, I would say, being able to express yourself and own yourself in the way you authentically want to own yourself. So what could this all mean for you? Like I said, I think right now what it means for you is that you're noticing these discrepancies. And the more, I would say, the more you can put yourself into environments where you do feel comfortable, go for it. And I would encourage you to start showing up as you are in environments that don't make you feel comfortable and getting over that tension of discomfort until you actually feel comfortable and you stop caring about whether you're being judged or not. Because that's going to be really important. You still have to walk this life in your own self-image that you create for yourself. That's really, really important for a lot of us. And there's always going to be environments that are not going to be very, very supportive of the way you express yourself. So that's what I would recommend. I would be hesitant to jump to that this could mean anything in regards to necessarily gender dysphoria as stemming from gender identity root issue. A lot of people today, especially young adults, feel social gender dysphoria, not so much physical gender dysphoria, whereas they feel comfortable with their body, but they feel uncomfortable how they perceive socially. And so they start gender band to explore that. And sounds like you're doing that too. And I would encourage you to do that and not be afraid to do that. Yeah, and I wish you all of the best. Question number 3. Hi, Dr. T. Thank you so much for continuing care you provide. You are so welcome. I'm starting the process of minimal depth vaginoplasty, but am scared of the recovery process. I don't want to go into it naive, but I'm trying to find a balance of not putting all the emphasis on recovery and being so scared to the point of not going through with it. Complicating it is the fact that my gender dysphoria comes and goes. I see. So what's complicating the fact is that your gender dysphoria fluctuates. So one day I'm like, bring it on. Then a few days later, I'm thinking I'm going to willingly put myself through this. Am I crazy? Is there no doubt about wanting to have the finished product, just the process of getting to that point? Thank you. So with any big surgeries, even zero depth vaginoplasty, one might say not as big as vaginoplasty with a vaginal canal. With any surgery, it's natural to experience fluctuations of, do I really need to go through this? Is this really going to fix dysphoria? Is it really tied to dysphoria? On top of that, if your dysphoria already fluctuates, you may be prone to this type of thinking. Should I do this? Should I not do this? If you're prone to this type of thinking, if your thought process ebbs and flows from, yes, definitely got to have the surgery because I have genital dysphoria, to I don't really have genital dysphoria right now. What the hell am I doing thinking about surgery? If it fluctuates like that, what I would recommend for you to do is I would recommend for you to really ask yourself, what would zero depth vaginoplasty give you? Why is it that you want and need zero depth vaginoplasty? Clearly on your list is also going to be to combat genital dysphoria. But what is beyond that? When people start making a list, they realize that part of it, beyond even experiencing genital dysphoria, is that they're looking for that congruency. They're looking for overall physical alignment that they've been really wanting for a long, long time. And there's nothing wrong with getting a gender affirming surgery in order to achieve that congruency, whether or not you actually have physical dysphoria or not. So I would challenge for you to sit down and to make a list, because when we make a list, we can see things more clearly. And I think that's going to really help you feel much more clear about your decision moving forward. Or maybe you're going to decide not to move forward with the surgery, but making that process to be very clear on what is your intentions behind surgery is going to be important. So that's what I would recommend for you. Question number 4. Hi, Dr. Z. First of all, I just wanted to say I've been watching your videos for nearly 3 years now, and they've been big help in coming into terms with realizing I'm trans and accepting myself. So thank you. You are so, so welcome. When I first started watching it, I created a whole separate channel just to comment anonymously about being gender fluid. But I'm now proudly out non-binary trans man and about to start on testosterone. Well, congratulations. That's a very big personal progress to go from being autonomous to, hey, I'm owning it, I'm showing up. That's fantastic. My question is, do you see many people who strongly identified with their gender assigned at birth as a child, who then became very uncomfortable dysphoric as a teenager adult? I know you've talked a lot about imposter syndrome, and this is one of the driving factors for me. I'm thinking it might be something to do with loving typically girly things as a child and being pigeonholed as the girly one by my mom and being dissuaded by her and society in general whenever I showed a remote interest in anything even slightly more masculine. I know you prefer if questions are kept short for your Q&A videos, and that was quite wordy. So the short version of the above is, do you see many people who strongly identified with their gender assigned at birth as a child, who then became very uncomfortable, dysphoric as a teenager adult? That's a good question. And yes, so I wouldn't say you see quite a lot. The reason why quite a lot is not going to fit in my private practice, because majority of my private practice are older adults. I oftentimes, the age range that I tend to see a lot of is age 30 and 35 and up. Majority of my individuals, clients that I work with in private practice have had an onset of gender dysphoria starting in childhood and have been struggling with it all of their life and have done everything and anything a lot of times under the sun to cope with it. Nothing has worked. And so they come to me to A, confirm that this truly was happening, and 2, what, if anything, they can do about it. And 3, I see a lot of adults who just decide they don't want to step into gender transition. That is not something that is fitting into their lifestyle. And so we work together on finding ways to alleviate dysphoria without stepping in a transition, because as I always say, gender transition is not for everybody. Having said that, for that reason, I don't really see, first of all, I don't see any teenagers at all because I don't work with minors. And I seldom see young adults. And yet, of course, in my practice over the course of now going on to 18 years, I have run into individuals, even older adults, who have no onset of childhood gender dysphoria. And then boom, suddenly one day they just, it's almost like you woke up and dysphoria was there. That is not uncommon. Today, what we are learning and understanding about gender dysphoria is that it doesn't have to have an onset early in childhood. There are a lot of people who don't have onset early in childhood. What I often say is, for individuals who are especially young adults who do not have childhood onset, but suddenly have an onset in their teens, what I would recommend is just explore a little bit more versus maybe being prone to jump to things, primarily because it's a fine line to distinguishing between the layers of how much of this is body dysmorphia, how much of this is gender dysphoria, how much of this is social dysphoria that's solely tied to your gender expression and role versus to a root issue of gender identity. So that's what I recommend. But no, it's not uncommon. there's a lot of people who have those accounts that they weren't aware until their teen years, or when puberty starts, suddenly that's kickstarts the process of onset of gender dysphoria. Different for everybody. Gender dysphoria is not really something that we can pigeonhole into this is exactly how it works, because it works and manifests very drastically differently from case to case. So hopefully that was helpful, and I wish you all of the best. Question number 5. Hello, Z. I love that. Hello, Z. I actually have I think I have 2 clients who call me Z. Hello, Z. Can you touch or talk about dysphoria as you age? Transitioning process is scary to older trans women. What is the best solution? Thanks. Yeah, absolutely. So gender dysphoria as you age. In my experience, gender dysphoria works, I hate to say this, but this is true, different for everybody else. Some people, as you will age, your gender dysphoria, if you continue not to do anything about it. By not doing anything about it, what I mean is not stepping into gender affirming care. If you just continue to cope with it by any means you have been coping with, for some of you, gender dysphoria is going to continuously get worse and worse and worse. By worse, what I mean is affecting you more and more on a psychological plane, and sadly affecting a lot of you more on a physical plane, where I have seen so many people that would have physical health concerns as a result of stress incurred by living with gender dysphoria. I have seen anything from gastronomical issues to high blood pressure issues, high cholesterol issues, migraines. I even have seen people suffer hair loss from the stress of gender dysphoria. So you have to be able to be your own self-aware individual. If you are in a camp where you feel like you can't, I don't want to say want, because a lot of you do want, but feel like you can't do anything with gender dysphoria, to be your own evaluator, whether what's happening. Are things getting worse for you or not? A lot of times what tends to also contribute to gender dysphoria getting worse as you age is continuing to denying, accepting that you have gender dysphoria. Remember, you can accept that you have gender dysphoria and not do anything about it. Continuing to avoid confronting it, and continuing to cope with it by unhealthy coping mechanisms such as drinking, drugs, overeating, throwing yourself into work and overworking. All of these things that, while they may seem like they take care of gender dysphoria, they're also chip away at your sanity and your health. For some individuals, gender dysphoria actually can sustain the same as they age. Again, that depends on how you're coping with it, and it also depends on your environment. Are you in a supportive environment? Are there other factors? It also depends on are there other aspects of your life that contribute to your sense of identity? For example, I have noticed that individuals who love what they do for a living, are really passionate about what they do for a living, and have gender dysphoria, tend to live with gender dysphoria longer without doing anything about it. I don't mean longer as in sense of lifespan. I mean in terms of being able to cope with it longer and keeping the coping the way it is. That's because part of their overall identity, gender makes up part of it. The other part is being filled in by what they really love to do, what they're passionate about, and that helps tremendously to reduce the stress over here. And if you read my book, I talk about it too, where I describe it as a pizza pie. For some individuals, gender dysphoria, actually as they age, this is very rare in my experience, dysphoria tends to lessen a little bit. What I have experienced, it's not that it lessens because it starts to go away. It lessens because you become better at coping with it, and you start to become very adaptive, very habituated to the distress signals, to the point where you feel like it's actually not as bad because you have got really conditioned to it. It's almost like living with a chronic pain, where the pain is still there, but you're not feeling like it's on a scale 10. You feel like more it's now 5 because you got habituated to tolerating that pain. So it's like I said, it's all of those 3 scenarios and more that it can fall into. It's hard to tell. When I work with individuals one-on-one, people always ask me, if I don't do anything about it, how it's going to turn out for me. And this is where my years of expertise and experience become very, very vital. And also my backdrop as a clinical psychologist, to be able to look at a person and look at their typology, their character, their personality, their coping skills, their mindset, assess all of those things that I talk to. And if you had a session with me, you've seen where I've done that, and then tell you, based on your personality type, based on how you cope with life, I would hypothetically say that for you, as you age, potential this what might happen. I've seen individuals who I can just see they're such anxious, ruminating, catastrophizing type that I can just tell them from the get-go that dysphoria is going to continue to get worse, because with a ruminating, anxious, very catastrophizing mindset, your mind going to continue to run in that direction. It's not going to get a peace of mind. It's going to focus all of that energy on trying to solve something that it perceives as a problem, but this is not a problem that a mind can solve. So it really varies. It depends. Everybody is drastically different, and it's different for everybody else. And if some of you watching this deciding not to do anything about your gender dysphoria, look at all those things. One of the best tips I can give you is that if your coping mechanisms are destructive, like I said, drinking, smoking, drug use, overeating, overworking, lack of sleep, lack of exercise, if your coping is not healthy, then I would really encourage for you to substitute this unhealthy with more healthier coping. What is a healthy coping? Eating well, exercising, giving yourself plenty of rest, self-care, finding other pleasures in your life, finding things that you enjoy. Those are all going to be really, really instrumental. Great question. And our last question for today, question number 6. Dear Dr. Z, many thanks for your professional insights and guidance, which are so helpful in understanding ourselves better. You are so welcome. I'm trans femme, male to female, and have been on hormones for around 10 years. At this stage, I have likely achieved as much feminization and breast development as possible from hormones. Does it make sense, if any, to stop hormones, as further male to female changes seem unlikely going forward? Will dysphoria return? I would highly appreciate your view on this. This is another really, really good question. And so you'd be surprised, by the way, how changes due to hormones may reach a tipping point and then hit plateau, and then suddenly, out of nowhere, you're starting to get these changes, additional changes coming up. So that's just something about the changes. Let me put it this way. When I work with adults, like I said, majority of my clients, if not by far all of them, struggle with gender dysphoria, physical gender dysphoria. When people are open to gender affirming interventions, for me, working with those adults, hormones are first and foremost is to help alleviate psychological distress. It is to help bring you peace of mind, to make that noise, that constant white, I call it white noise in the back of your head. It's almost like, those old computers where they had the fan that kept going and going and going, to quiet down that fan so it doesn't overheat all of the time, so that you can focus on other things. So for me personally, first and foremost, hormones are to alleviate psychological effects of gender dysphoria. The changes to secondary sex characteristics are obviously a very important aspect of it. For me, it's secondary because, in my opinion, if your mind is constantly having that noise, it's really hard to focus on anything in your life unless you are able to bring it down or eliminate it completely. So I would encourage you to think what got you to start hormones to begin with. Some people who start hormones solely for physical changes, in my experience, are oftentimes people who identify as non-binary folks, people who identified as genderqueer or gender non-conforming, people who want some changes, minor changes, sit into microdose, people who maybe want to experience certain things. For a lot of specifically trans women and trans men, individuals in my experience oftentimes tends to be on hormones for the duration of their life because, again, of the psychological primarily benefit that they get off of it. So ask yourself what got you to start taking hormones to begin with. If you're concerned will dysphoria return, I would probably say chances are yes, it would. It could not return for you. I have yet to see, honestly, a client that I worked with who stopped hormones and dysphoria just disappeared. A lot of you have done this. This is very classic. A lot of people go on hormones, they feel better, and they feel like, I'm done. Dysphoria is gone. I don't have to worry about going through anything else. I don't even have to go through gender transition. That's it. I can just stop now. And a lot of you do stop hormones, and a lot of you can comment below, because what happens is, chances are not only did your dysphoria came back, but it came back even stronger. And it's not necessarily that it's stronger, it's just that now you feel it even more acutely because you now have something to contrast it against the peace of mind that you had for the first time in your life. So you may look, people do stop hormones all the time. You're not nothing, do it under medical guidance, of course, as a medical doctor. You can definitely, if you want to give it a chance, try it. And if you decide not to take them, that's okay to do too. You may want to talk to endocrinologist for sure, because your body does need hormones. And then you have to ask yourself, well, what's going to happen? Is my body going to revert to producing the hormone that I don't want it to produce? So there's a lot of things that you need to really weigh and discuss on the table. In terms of dysphoria, yeah, I haven't seen it ever go away when people stop hormones. In the cases I personally worked with, it always came back. But that's just in my cases. I would never say there's no individuals out there to whom it's, have been similar to my cases. I'm sure there's some people out there who had different experience, but at least in my cases, I haven't seen anybody where dysphoria just completely disappeared once they stopped taking hormones. So yeah, think about it, talk to your medical doctor. Obviously, 10 years on hormones is a long time. Find out how it may affect your health, discuss all the pros and cons, and really ask yourself, what made you start hormones to begin with? What were you looking to achieve? Yeah, so hopefully that was helpful, and I wish you all of the best. Thank you, everybody, for your wonderful Q&As. Like I said, I will continue the segment until I'm done with the questions that I have in the Q&A folder. Having said that, tune into the podcast that is coming out every 2 weeks. Hopefully, I will see you all there. Other than that, have a wonderful holiday season if you're celebrating Christmas and a New Year. And I will see you again soon. Have a good one. Goodbye.